Good day, everyone. My name is Raymond Hilton. I am reading for the doctoral degree in Christian counseling, and my presentation today is entitled "Stained Glass Window: A Peek into Depression." As you see in my first slide, I use a stained glass window. And the purpose and the reason why I use this stained glass window is because individuals who are suffering from depression tends to have difficulty seeing the brighter side of life, and sometimes they see themselves in a very dark place, struggling to see the bright side of life. Hence, the stained glass window. You see the beauty from outside, but internally the person is suffering. During this presentation, I will examine from a Christian perspective, look at types of depression, therapy, effects, and how people can cope with depression. Depression is not one of the easiest subjects to be addressed, especially if you have someone close to you who have been affected. And we all know that one of the challenges that people face is the whole thing about taboo. People are afraid of discussing it because it makes them look bad and all those type of things. So it's not one of the easiest subjects to discuss. Depression does not choose people based on their zip code, status in life, or ethnicity. Depression is no respecter of person. Not even Christian is exempt from depression. Depression came in our world as a result of Adam's fall and subsequent sin. And this has passed from one generation to the other. In other words, when God made the world, it was perfect. But when Adam and Eve fell from their lofty position, sin came in, and that degenerated nature passed from one generation to another. So depression is a result of sin. Sin. That's a Christian perspective. Many people in the Bible experience depression, including you have King Saul, Elijah, and David. Depression affects all ages, and experts have seen a rise in the number of children and adolescents who are suffering from this paralyzing disease, and in most cases lead to suicide. So, in other words, depression is on the increase. And one of the things that I've discovered during my research is that if you examine the historical records, industrialized uh, nations are prone to depression because of the high level of demand that the society place on individual work, um, taking care of family bills and all the other things. The fast pace of life. Yeah. From a biblical perspective on depression, we discover that sin brought curse upon the human family, and that depression is one of those fruits. Yeah? The Bible makes it clear that the suffering experienced by mankind came about as a result of sin. So all the problems that we are facing were originated in the Garden of Eden because of Adam's sin. Okay? We also see that God invokes the consequence of sin on the human race by laying out what befall Adam's generation for centuries. Thorns and thistle shall it bring forth for you. Yeah? In other words, mankind or the human family was plunged into a lifelong turmoil because of sin. The effect of sin, the effect that sin has on the capability, on your man capability, will slowly deteriorate, thus reducing the psychological, physiological, and spiritual fortitude. The environment that we live in also has a telling effect on the chance and the effect that depression will have on the individual. One writer concluded that there is nothing therapeutic about sin. Yeah? Nothing therapeutic about sin. I like to emphasize that. Sin does not help an individual. Either to get better, yeah, to get better, it only increases the person's chance of getting worse. Okay. David experienced depressive episode, especially the moment when he committed the sin of adultery and murder. He found himself in a dark place, and the mental pain was excruciating. He cried out, "When I kept silent, my bones grew all through my groanings all day long." In other words, that turmoil, that internal struggle, trying to get peace, you know, and contentment, as long as that ill conscience or the conscience bothered him, he felt that he was suffering, that he was in a dark place. Christian psychologists dispute such and present two important uh, facts. Our allegiance with God does not free us from depression, and secondly, depression is a chemical imbalance that might be contributed to one's depressive mood. Huh? So those are two key important factors. Christians are not immune from depression. Okay, so here's a question: should Christians surrender to depressive ideation or continue to trust in God? Huh? Generally, when somebody going through this period, they generally question whether or not God is faithful. What did they do? I remember what Jesus, when the question was asked Jesus, was this man or his parents sin? Why he is suffering? And Jesus make it clear, no, that was not the case. A Christian view on depression. Uh, Christian Christian stand firm on the word of God and have complete trust in Him. And we know that God does not willingly afflict His children. Yeah? So God is not in the business of punishing individual or throw upon them depression, bipolar, and major depression, are those things. God is not in the business of doing that. Christian knows that even having faith in God is Christian knows that having faith in God is good. However, it does not immune them from the effects of sin. Christian believes that even though sin brings darkness, there is a light at the end of the tunnel. So this is a Christian hope. The Christian believe that even though he or she is going through this dark period, this difficult period, there is a light at the end of the tunnel. So he has hope that things are going to get better. Depression does affect the Christian. Depression does affect the Christian too, And while he might go through years of pain and misery, his faith in God is being renewed day by day. So he has faith in God. Gary Collins noted that Elijah saw God's mighty power at work on Mount Carmel, but when Jezebel threatened murder, Elijah fled into the wilderness and were plunged into despondency. He wanted to die and might have done so, except for the treatment that came from an angel sent by God. So, depression, one can easily go into that place, that dark place. And we discover that Elijah experienced that dark moment in his life. So, depression is, there are many, there are many effects that depression has on the individual. Sadness, the person sleep excessively, irritable, suicidal, and suicidal ideation, anxious disorder, word person feeling ashamed, melancholy, despondency, and all those things. Depression is a very complex sickness, and psychiatrists use it to identify syndrome of sadness, hopelessness, and sluggishness accompanied by many disturbances. According to the DSM-5 Made Easy, depression usually experienced as a mood lower than normal, and patients who suffer from depressive mood experience feeling of unhappiness, disheartenness, and blues. One of those, the blues, what we call the SAD, seasonal depression syndrome. Depression belongs to the group known as what we call mood disorder, which include manic episode, mixed episode, and seasonal affected disorder. And earlier on, I mentioned that that is a dark place that an individual who is experienced depression go through. That sadness, that period where the person wants to be alone, different mood changes, and so forth. Category of depression we have what we call less severe, more severe, less severe, what we call seasonal depression, dis, this dystemic depression, more severe as what I call clinical depression or major depression. Major depressive disorder. A person is considered clinical depressed or suffering depressive disorder when five or more of the following symptoms are observed. Number one, the depressed mood lasts for an entire day, making you feel empty and sometimes tearful. You have no pleasure in doing the regular or normal activities of everyday life. Experience in sleeplessness, or you sleep, you wake up, and different change in your sleeping pattern. Person who who are experiencing depressive disorder, they generally feel tired easily, fatigue, loss of energy every day of the week, have regular suicidal ideation without specific plan to carry it out, even attempt or even attempting suicide. So the person who's going through the depressive disorder um, will have this idea that the best way to end his or her life is to commit suicide, but generally they do not make practical step to commit the act. Dystemic disorder, a person who suffer from dystemic disorder tend to suffer it in silence and consider chronicle depressed over and cover their disorder. They generally put a lot of energy in their work and social life. So the person who's going through this depression will put a lot of emphasis in their work, yet still they cover it up. What we call a facade. They believe, they sometimes think that nothing is wrong. I am okay, and all that. An individual who has been diagnosed with persistent depressive disorder sometimes have episode of less severe pain. However, the symptom generally lasts for 2 years. Major depressive episode. Some identify mark or symptoms: poor appetite or overheating, sleeplessness, what we call insomnia or hypersomnia, lower energy or fatigue, low self-esteem, poor decision making, feeling of hopelessness. Types of depression: we have major depression, where a patient who suffer from one of our more depressive disorder with no manic symptom is said to have a major depressive disorder, and a full episodic ends when there is no recurrence over what we call a 2 month period. Chronic depression, a type of chronic depression is what we call um, premenstrual dysphoric, which is a severe type of a different type of painful menstrual or disorder which lasts over 5 days. It is generally called PMDD, and some of the symptoms are depressive mood, feeling of hopelessness, marked anxiety or tension, feeling on the edge, persistence are marked by anger or irritability, loss of interest in normal activities, difficulty in concentrating and focusing on attention, and sleeplessness, or sleep and wake up, sleep and wake up. So there's a difference. One is lack of sleep, and one hypersomnia. Persons sleep a little, wake up, sleep a little, wake up, or taking short naps. And seasonal affective disorder is what we call winter blues. You know, people who live in cold area or cold countries during the winter experience that we call a seasonal affective disorder. Depression causes, we have genetics, brain chemistry imbalance, poor nutrition, um, narcotics are, drugs, physical health issues, stress, and so forth. Cause and treatment of depression. Well, depression is caused by genetics, or what we call imbalance of the hormones. We have physical illness. Physical illness, increases the person's stress level, and such put the person in a dark place. Uh, Stress, drugs, other factors that contribute to depression are called life events, such as life event that a person experience some sudden failure, abusive life, person experience abuse, loss of a loved one to divorce or death or separation, anger, childhood life, decrease in physical health. Treatment of depression. Treatment of depression is divided into two areas. We have what we call medicated therapy, and we have what we call psychotherapy. And psychotherapy can cover what is known as, we can know what area we call cognitive behavioral therapy, interpersonal therapy, and other types of therapy. Uh, Data on depression in the United States, as the chart indicates, that anxiety, over 40 million people in America, or 18% of the population, suffer from anxiety. Major depressive disorder affect 18 and older, 16.2 million, or 36%. Social anxiety disorder, or 18, affect the age of 18 and older, the 15 million, or 6.8% of the population. Persistent depressive disorder, 3.3 million, or 1.8%, 1.5% of the population. PTSD, generally, people like, soldier who have experienced come back from war, Like many soldiers who are coming back, like Afghanistan, Iraq, or those area people who have experienced seen traumatic, um, experience traumatic incident in their lives. Will experience what we call post-traumatic stress disorder, and um, postpartum depression. Uh, for 4 million, and generally affect women. Uh, Postpartum generally, affect mothers who just have baby, who just have a child, or give birth. Generally experience that difficult period where there's a difficulty in bonding with their newborn, and 15% of the populations experience that type of depression at one point or the other. Ethnicity and depression. Uh, Based on the data collected from CDC and other health institution, African American stands a 16% chance of suffering from depression. Hispanic 15%, whites 19%, and it must be made known that even though 19% of the population, which white, suffer from depression, uh, 46% will seek help, while in African American, less Americans seek treatment for depression. Asian people from Asian 13.4%, two or more races 24%, African American Indian Alaska Native 22%. And one of the reasons why American Indian or Alaska Native have a high percent of suffer from depression is because of the lack of sunlight or vitamin D. With the depression, one of the key areas for people who are coping with depression is a healthy community. A healthy community goes a long way in helping the depressive individual cope with their depressive episode. So if the person is in a loving community where there is shower with care and there's a strong support system, it works better for the person who's suffering from depression. Nutrition, nutrition is very important because nutrition and diet are important to maintain a good health in patients with depressive disorder. While no one specific group will make the depressive feel better, it is important that they adhere to proper nutrition and guidelines. In other words, eating one particular food does not necessarily will help you, but a good dietary approach and good nutrition sort of ease the burden of depression. Exercise improves the mood in the patient with major depression and reduces the depression and anxiety and hostility in patients. Water is essential to the cleanse of the body internally and externally, and get rid of some of the toxic and impurities. It rehydrates, it restabilizes or strengthens the body immune system, increases energy, reduces headache and digestion. And we can see here happiness is a mood, positivity is a mindset. Yeah? Sunshine, sunshine, we know we get vitamin D from sunshine. And research have shown, or even shown, research have shown that people who have less exposure to sunlight have a higher chance of suffering from depression. So it's important for the individual to be exposed to, to sunlight, and also take a vitamin supplement. Self-control, depressive individual has a limited capacity to function normally, and exercise restraint or self-control recover is a recovering principle that will aid in their recovery. Fresh air is also very, very important. Rest. We need at least 7 to 9 hours of rest, and people who are depressed need to get adequate amount of rest. Trust the Christian view of life, the care of God upon his acknowledge the care of God upon his or her life. And the counsel from Solomon says, so trust in the Lord with all thine heart, and lean not unto thine own understanding. In all your ways acknowledge him, and he shall direct your path. And it is important for one to have a happy mood, a happy mindset, eat right, and have a, for the Christian to have a closer walk with God. Depression, depression is a very difficult subject to deal with, and it's important for all the all the therapy to be put in place, medication and psychotherapy. So I want to thank you very much for sharing in this presentation.